Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course.
Brad, I think I figured out why the Vikings are having so much trouble at the quarterback position.
Because they suck?
They suck, but they also maybe he has a rotator cuff tear. If you have a
Oh,
rotator
yeah,
cuff tear,
yeah.
He can't throw very well.
Yeah, maybe we should talk to the trainer.
Yeah, maybe give him some hints. And that's what we're going to do with you today. We're going to give you 3 signs that you might have a rotator cuff tear. If you're
Sure.
having shoulder problems, we want to show you 3 tests you can do to determine, you know, if it's a possibility.
Right.
It still could be other things,
Right.
but this would help narrow it down. First off, when you have a rotator cuff tear, well, what is a rotator cuff first, Brad?
The rotator cuff, as we have a video on the pronunciation, we won't get into that, but it helps, it stabilizes the shoulder joint into the socket.
Exactly.
It's a very shallow socket. That's
4 muscles.
Right.
4 muscles that work together to hold the bone into the socket. They also do certain movements, and that's what we're going to be testing.
You bet.
So if you tear your rotator cuff, you're actually tearing the tendons on it, and you're going to probably have pain first off.
Mm-hmm.
And you can do this, by the way. You can, if you just want to know this, what leads up to a rotator cuff tear. It can happen over time.
Sure.
A lot of them do.
Repetitive
A lot of them
motion.
happen if you are 40 and over, which fits right in our genre, doesn't it, Brad?
Absolutely. 40 and over, subscribe right here.
Yep, if you're 40 and over, we're going to provide you videos on how to stay healthy and fit and pain-free.
You better believe it.
Going back to what we were talking about, if you're 40 and over, or even if you're not, you could do it obviously with an athletic event, but also a lot of them occur over time, they just get wore out.
Right.
Your blood supply as you get older is worse to your shoulder, and that also makes it, you're more susceptible. So you got the 4 muscles. You're going to have pain, obviously a lot of times right in this area, and it can refer down.
Yep.
If it goes past the elbow, it may not be it. It may be more likely a nerve problem.
Right.
These are the 4 tests that you want to do. 3 tests. I guess we got 4.
We'll call it 3.
We'll call it
with
3.
a bonus.
With a bonus.
Okay.
So first one is, one of the first muscles that, the most commonly involved muscle is the supraspinatus. You don't need to know that, but, and the way to test that, you want to be the tester, Brad?
No, you be the tester.
Well, then you got to stand up.
Okay. The supraspinatus, by the way, the muscle belly, the supraspinatus is here. The tendon
Comes right
down in here.
And the muscle does this.
Right.
So-
Elevates down.
So Brad is going to, we're going to say the right arm is always the problem arm.
Sure.
Okay? So we can maybe turn a little
You
bit
bet.
like this. So we're going to have him put both arms up, turn it down like you're emptying out a can.
Yep.
That's what it's called, in fact. Your arms are about 30 degrees forward and up to close to 90. I think that's where they're
Great.
tested. Right
Yeah,
like
right
that.
there.
Yep. And all you do is have somebody push on there. You push right by the above the elbows here,
Yep.
and push. Now if this one gives way,
Let's do this arm because they can't see.
okay,
the
sorry, this is the involved arm.
Right.
Okay. This is-
Oh, okay.
Oh. So I push on both equally, and that one just gives way.
Right.
Could be a rotator cuff, could be a tendonitis or
Sure.
impingement,
Right.
but it's starting to give you a sign that it might be a rotator cuff. One you could try on your own is you could just take, if you're having trouble with this arm, you can't even raise it up, take it and use the other arm to raise it all the way
Yeah.
up, and then start bringing it down, just let it come down, let it come down to the side, Brad, and if it gets so far and all of a sudden it just drops. That's the drop arm test. That means that you most likely have a tear and that it's not holding up. You have a rotator
So
cuff
again,
tear.
you bring it up and then let it down and see if you can let
Hold
it
it.
down slowly. If it goes like that.
Pretty
Yeah.
good sign you might have a rotator cuff.
I know one, I had a patient, I've seen this in a number of patients with rotator cuff tear. You ask them to lift their arm and it's so bad, they go like this.
Yeah, they do
A lot of
substitution.
compensation, yeah.
Hi, Brad. Anyway, all right, another test. Now for a different muscle. This is the teres minor and the infraspinatus. Muscle here, and they're both down here on the lower part of the shoulder blade, also attached here. So again, this is the weak arm. Turn a little bit like this. I'm going to push in like this, and he's going to hold it with his arms at a 90-degree angle. Push in. If that arm gives way, could be a rotator cuff tear.
And it usually hurts.
And usually hurts along with it.
Yeah.
Last one is the lift-off test. You can actually do this one on your own.
Yeah.
Do you want to show it, Brad?
Sure.
So you just put it behind.
Like this, like you're gonna scratch your back. Instead of doing that, you lift your hand away from your back like that. Maybe you can see it better with this arm here.
And if you can't lift your arm away, you may have a tear. Because that's not
If you can't.
If you can't.
Right.
If you can't lift it, you may have a tear.
Okay.
So, just very quickly, the tears that usually happen, there can be a partial thickness tear, And in that case, the tendon just looks like it's been roughed up.
Right.
And probably, that's not something you're definitely not gonna have surgery on. It's
Right.
just something hopefully that'll get better over
Right.
time. Two, you can have a full thickness tear where there's actually, could be a pinpoint spot that goes all the way through the tendon, or bigger, a
Right.
larger hole. And then there's also the full thickness tear with actually complete detachment. And this actually can show this on here. This is just, we'll take one of the muscles here. Here's the subscapularis, and you can see it attaches to the bone here. You're gonna have to bring that in, Nancy. And this is the white stuff is the tendon. The muscle narrows up to a tendon, and then it actually completely detaches from the bone. And it could actually, the muscle could actually retract away.
Right, yeah, it's no good.
So that, in that case, you're gonna probably need surgery.
Yeah, they have to go in there and reattach it. But, so again, the three tests are,
Very
the first
quickly.
one, the empty can test, okay? The internal test, the pull away from the back
Yeah,
test.
and then the one you can also add in
Oop.
is the
And
drop
let
arm
it
test.
down. Oh.
All right, good
All
luck.
right, have fun with those tests, but be
Yeah.
careful.